It's been just 8 days since the first COVID-19 case was confirmed in Rwanda, and already the total number of those infected is 19. And although top Ministry of Health officials have noted that none of the cases are critical, it is no reason to take the situation lightly.
Ubundi tugira aho twakirira abafite ibyo bimenyetso byibanze.
We have a center to receive those with the preliminary symptoms and another location that can be used for those in critical condition, in need of assistance to breathe and other emergency conditions. Up until now, there is no one at that second location, right from the time we began the operation, which is good news. That gives confidence, but we do not want people thinking this is just a simple disease. This is why these measures are now in place, to restrict people moving from Kigali City to the provinces and back, so that we can care for those infected and protect those who have not yet become infected, and then see what sort of figures we have 15 days from now, and then other measures can be implemented depending on how the pandemic situation will be at that time. The country is now essentially locked down, with borders, bars, even shops and markets except for those selling foodstuffs and sanitation essentials all closed. Other establishments that have remained open are pharmacies and petrol and diesel stations, among others that provide necessary services like banks. Those that fail to respect these measures are to be punished according to the law. Let us assume that a person opens their shop illegally, or a bar. The Ministry of Trade and Industry has instructions, and so does the Rwanda Development Board. Punishments exist. For those who go out into the streets or onto the roads, traffic police personnel will impose fines on such people. You might get a traffic violation ticket if you are found to be carrying people or things illegally in your vehicle. Employees are now working from home. Taxi motorcycles are not allowed to carry passengers, and people have been called upon to leave their homes only if they must go out to buy food or go to hospital. This presents a problem for people who work for wages on a daily basis.
Wifashe ukarya duke cyangwa ukagira uko usaranganya nabo mwegeranye ariko ukirinda wahitamo iki?
If you are able to reduce your daily rations or share with those around you, but protect yourself, what would you choose? We do not wish this upon anyone. It has not yet happened in our country, but this pandemic might kill you. That means our decisions must be based on the fact that this is something serious that we want to truly mitigate. As for other issues, the country must find solutions and look into ways people can assist each other, with families in dire need of help cared for. We don't want to protect people from the coronavirus only for them to die of starvation. Solutions must be found at the local government level, but they must respect the measures in place to protect us all.
The
coronavirus pandemic has now infected more than 340,000 people in 188 countries globally and killed more than 14,500 of them.